Hello everybody, and thank you for joining us tonight. We promise you that it will be a very special night and very good time together, because today in this webinar, me and Mr. Muhannad Abdul Jawad will discuss two very interesting topics in dentistry today. The first topic will be about the 3D smile design, which is very interesting, where I will discuss with you what's 3D smile design and why it is important in your daily life, and how can you increase your income by 3D smile design. Then we will talk about how can you do the smile design easily in 3 steps and in 3 minutes. After that, many topics we will discuss about 3D smile design and how can you make it in real, not only on screen. After that, my colleague Mr. Muhannad Abdul Jawad, he will discuss with you and he will talk to you about professional dental photography. He will give you very important tips and tricks.
Hello everyone, I'm very happy to be here in this great webinar. So today I will give you introduction about dental photography. I will talk about many things about dental photography, and I will talk about GPS 3D smile design photography, how we can take one only facial picture by using 3 main rules in this webinar.
I really recommend you to give attention until the end of this webinar, because at the end we will offer you a very special thing that you will enjoy, a free gift from Dental GPS 3D Smile Design. Let's go ahead in this successful journey together. So I will start with the first topic, which is digital smile design. Tips and the tricks. And before I start, I would like to ask those people who would like me to speak in Arabic, please write an email to alaisa@mastery-academy.com, or you can call the telephone number on screen and ask for the Arabic version. And also for those who need certificate of attendance, you can also ask a certificate by writing to this email or calling this number. يعني قصدي اللي بيحب ياخد نسخة العربية من هاي المحاضرة، أنا مستعد لتقديمها باللغة العربية، فقط أرسل طلبك إلى هذا الإيميل أو إلى هذا الرقم الجوال. We will go ahead now with English. Today in this webinar, I will talk about these topics. The agenda will be, what's a 3D smile design and why 3D smile design is important, how to increase your income and productivity by digital smile design. Next question is it real or it's only on screen? Then, how to design any smile in 3 steps. Then we will see together and we will watch a video, 2 videos for case reports. The last 2 topics is how to become a certified smile designer and how to become a professional certified trainer. I will cover all these topics in 15 to 20 minutes. First, what's 3D smile design? To make it clear and easy to understand, please have a look to these 2 beautiful pictures. But I would like to ask, from engineering point of view, from building beauty, which is more beautiful from engineering point of view? Of course, everybody will say the left one. The next question is, do you think that the engineers or the contractors who built this beautiful building, this beautiful holy mosque, did they reach to this result by coincidence? Did they do it randomly? Did they do it without a clear and specific planning and designing for each and everything in this building? Of course, everybody agree that in engineering, when they build a tower, they plan and design every single thing in this tower, right? So the question is, why in dentistry we do not see the final result before we start? In engineering, they see everything. They see the final result in all the details before they start. On 3D models, they see every single detail in the building. So why in dentistry we give the dental technician the responsibility to wax up and design the wax up for our mock-up according to his experience, not according to the design that we decide and the patient approve? So if I tell you that we can design the smile like what you are seeing now in this picture, we can design and see the final result. This is the design. This is not the final result, but we can see the final result even before we touch the patient and the teeth. Look at this picture, is the same of this picture. Same clothes, same smile, same hair, same eyes, same position, everything is same. So this is the design we did on the picture of this patient. Before we touch, before we prepare, before we take impression, before doing anything. It is all on computer using one facial picture. And here you can see the final result we got after the design. Look at his smile. Now he is different. He is smiling with confidence, and he is getting exactly what he approved on the design. So before we start, we can design and see the final result of the soft tissue and the hard tissue of the mouth. And this is the smile designing. The harmony that we decide, the harmony that we see on picture before we start. And so we are starting from the end. Start from the end. Start and the end on your mind. But the big question is how? Is that real? Can I convert this picture to reality? This is the big questions that we will answer together in this lecture. But we need also a very simple way to do that. We need to use one facial picture, one panoramic X-ray, and we want to show you our patients more than one design. So if he needs a procedure in soft tissue like gingivectomy, we have to give him many options with gingivectomy or without gingivectomy. For example, if he needs midline shifting by ortho, we should show him two designs so we help him to take the decision and to understand our treatment plan. So multi-designs for one patient. Look at this case. The same picture. Look at this case, the same picture. This is the design. This is the way she arrived to the clinic, and this is the first design we made for her. And actually, this is not my cases. I will tell you in a minute these cases for whom. So this is the first design we made for this patient, and this is the second design, and this is the third design. Please try to tell me what's the difference between the first design, the second design, and the third design. If you can note that here we changed the color of the gum, so we made depigmentation, so you can show your patient how the depigmentation looks like, instead of explaining to him that we will change the color and we will do this procedure by lasers or by surgery. Instead of all of that, you can just show it to the patient on picture. Here, what we did is gingivectomy. We cut the gingiva on the design, and here without gingivectomy. So what I want to say that from one picture you give multi-designs for the same patient, and we will see how can we do that and is it real or no. And you show the patient immediately his current position, and his current case, and his current situation, and the future situation, even before you touch his teeth. And here is the secret. Here is the meaning of designing. Second question, why 3D smile design is important? Of course, you know it's very important because what you see is what you get, and that means you get perfect results. You get perfect results because no mistakes. And number two, you and your patient and your dental technician are on the same page. There is no different understanding. There is no different imagination. Number three, it's very effective diagnostic tool, and we will see in minutes how can you use the smile design softwares for diagnosis. Number four, zero post-operative objections, because the patient agreed in the beginning and he will get the temporary exactly as the design, so the final will be exactly like the design. This is Dr. Marco from Italy. He said, GPS 3D smile design has become an essential tool in my office, just like the computer and the panoramic X-ray. I can evaluate a turnover increase of roughly $250,000 per year because of the 3D smile design by Dental GPS. And this guides us to the next question, which is how the digital smile design can improve your productivity and your income by 20%, 50%, 60%, and maybe 80%. Why? There are 4 ways, 4 ideas, and 4 reasons. First, studies show that when you show your patient the final result before you start, you increase the acceptance ratio from 15% up to 40% or more, maybe 50%, 85% in some cases. And what that means? That means if you got only one case because of smile designing, you are making about 10 units. So if you are making roughly in our countries, if you make the unit with $350, that means $3,500 per one maxilla, one case upper teeth only. What if you got 10 cases per month? That means $35,000 more. This is the first reason. Second reason, for the same patient, if you have a patient who asks you to make his smile from canine to canine, and he refused to make it from 6 to 6, when you show him the design from 6 to 6 and you show him how it's different, of course you will get his approval to make more units from 6 to 6. So if you get more units, in each case 6 units, that means $2,100 extra. Third reason, that you convince your patient to make more procedures. It's not only crown, not only veneers. You can convince him to do gingivectomy. You can convince him to do orthodontics, because you will show him on screen how the result will be without ortho and how it could be with ortho. You can also convince him, for example, to do depigmentation. And also, it's very important and very advanced to make vertical dimension opening. And this is advanced procedure. Number 4, when you do very beautiful cases, for sure you will get more referrals and more patients by the word of mouth. And this is the big advantage of 3D Smile design. Now, the next question. Is it real or only in screen? Actually, in the world, there are so many digital smile design tools, but unfortunately, only few of them you can convert the 2D design into a 3D in reality. What that means? It means it's not easy to convert a picture of design into reality that you will put in the mouth. But good news is that there is some few tools in the world which help you to do that perfectly and precisely. One of these tools is called Dental GPS. And Dental GPS was created by a Canadian doctor. His name is Alain Mithot. In few minutes, I will show you his pictures and how did he do that. And here is the evidence. Look at this case, how it came, and then the design, and then the final result. Another case, how it came, the design, and the final result. And this is another case. Look at her, how she is now smiling with confidence after the final result. And this is the design, and this is how it came. And the design was made immediately on the same picture, and then this is another picture, another time. That's why she is smiling in different way. Look at this smile. It is the same smile. This is another case. How we converted the 2D smile design. This is the design, and this is the final. How to convert the design into a final. This is the big secret of the Dental GPS. So now the next question is how to design in 3 steps. Actually, you know that smile design means the harmony in between the soft tissue, hard tissue of the mouth and the soft tissue and hard tissue of the face. But what did Dr. Alain Mithot said? Dr. Alain Mithot, I met him a few years ago, and he said that he can do that by computer. So you don't waste your time. Because dentist has no time to waste, he created a software that distributes the space, the distance, the inter-teeth distance on the teeth by mathematics on computer. So you don't need to measure anything manually. Because dentists have no time to waste, and Also, we need some reasonable price for the tool that we will use. We don't need very expensive tools and also no time consuming tool. That's why he created the M ruler. What's M ruler and why M? M, it came from his family name. So the family name is Mitho. The M ruler is mathematics calculated by the computer, and this method compares the tooth width with the facial width using the software. The whole analysis is done in computer and hence involves more of mathematics rather than artistic analysis. So you don't need to measure anything manually. You only need to insert 3 inputs in the computer using one facial picture. So one facial picture you inserted in the dental GPS software. Then on the picture you give 3 inputs. Number 1, width of the 2 centrals. Number 2 is the interteeth distance, which is between these 2 green lines, and the number of teeth in each side. So according to these three information, the mathematics inside the software gives you the M ratio, and the M ratio for this face, for example, it's 1.4051. And then he gives you the ideal distribution of the distance, the ideal design, default, he gives you immediately. Then you are free to modify this distance and this design. I will show you in the next video 2 cases and how we design using the dental GPS software. Look at this first case. We select the patient, one facial picture, and then firstly we make the digital face bow, and I will explain to you what's digital face bow later. Then using the yellow lasso, this lasso, we determine the field of view, and you can see here that we are working on a denture. It's partial denture. So the smile design, it's not only for veneers and the crowns, but it's also for dentures, also for composites. You can design everything by this software. And it is easy to use. Here he is giving the width of 2 centrals. From library you can select the shape of the teeth. Look at the shape, how it's moving. Adjust the occlusion plane according to the natural teeth, and that's it. Immediately, in few minutes, the computer gives you the first design. Then you can make another design for the same patient. He asks you, do you want another design simulation for the same patient? If you say yes, then you go ahead again and make the same and make another. Look at these 2 green lines, which is the interteeth distance. And now we have another design for the same patient. You see, first proposal, second proposal for the same patient. I will show you now Another case. After this one, we will see one difficult case. So here you see two different designs. Video number 2. Again, we insert the name of the patient, the date of birth, then we take the name, the picture, one facial picture, only one facial picture, and this is one of the biggest advantages of this technology. This patient. After inserting the facial picture, we make the digital face bow. And now we will see another case. Firstly, we insert the name of the patient, the date of birth, then we select one facial picture. And this is one of the biggest advantage of this software, Dental GPS, which is using one facial picture, not multi-facial pictures. Then we make the digital face bow. First step is doing the digital face bow. And for the facial picture, as you know, my colleague, Mr. Muhammad Abdul Jawad, will explain to you exactly what are the characteristics for the facial picture, and he will tell you how to do it. After making the digital face bow, we make the selection inside the lips. Then here we are selecting the number of teeth of each side. Then the interteeth distance by these two lines. You can note that we are not measuring anything. We only put lines in place, then the computer work automatically. And this is the biggest advantage. Here we insert the width of the two centrals. Then automatically the computer gives you the default and the ideal design. Then you as a dentist can compare between the original position of the teeth and gum and the new position, which is these lines. So you can control the design according to your experience as a dentist. Also, you can control the length of the tooth. You can control the occlusion line, and you can control the height of the gum. You can also create gingivectomy on the design, and you can know exactly how many millimeter is that gingivectomy. Look at this. You can compare always, in any step, you can compare the new position of the last and the last position. Did you see how easy and fast it is? Now another design for the same patient. Look at this, how refining the case, and also you can control the color of the gum, the color of the teeth, the height of the gum, everything. Now this is another simulation design for the same patient. Look at that. How fast it is, how beautiful it is, how realistic it is. This is the dental GPS. Yeah. What you see is what you get. And this is the third point, that it's very important to know that with GPS you can convert this design into reality by sending the design and the impression to the dental GPS office in your area or in your country. So the dental GPS office in your country convert this into WhatsApp exactly as the design. Now the next question: how to become a certified smile designer, and then how to become professional certified trainer. I will answer on these questions after my colleague Muhammad Abdul Jawad talk to you about tips and tricks in dental photography and how can you take professional dental photography for the dental smile design or the 3D smile design. The rules of the dental photography, I will leave it to Mr. Muhammad Abdul Jawad. He is expert in dental photography. Thank you very much. Then I will come back to you talking about these two questions.
Hello everyone, I'm very happy to be here with you on this great webinar. So today I will talk about 3D smile design photography, how you can take only one facial picture by 3 easy rules for taking this picture with yes and no and maybe rules. So the goal is being able to take a photo with simple and specific standards that is suitable for using for GPS 3D smile design. Okay, for that purpose, we only need a camera, whatever the camera you have. If it's a compact camera or semi-professional camera or a DSLR or professional camera. And we need a flash. Okay, now, if you have a camera, you will learn how to use it. But if you don't have a camera, you will know exactly which camera is the best for you. Okay, let me now talk about types of cameras, starting from the first type of cameras, compact cameras. Compact cameras, small, and they are small, light, and very cheap. They are fully automatic. They are very simple to use, and there is a built-in flash and LCD screen at the back, and there is no eye viewfinder. They are very easy cameras, like your mobile. This is the first type of cameras. Okay, let me tell you about the semi-professional cameras. So these bridge cameras are between the compact and professional cameras. They are in the middle. They are fairly large. They have manual control. Some will have HD video recording, and they have eye viewfinder. These cameras often benefit from powerful zoom lenses, and they have a built-in flash and LCD screen at the back. This is the second type of cameras. Let me now talk about the professional cameras or DSLR cameras. These cameras, usually fairly large, they have manual control in everything, and the choice, of course, they are the choice for the professional photographers. They are interchangeable lenses, and they offer high image quality. They have a full manual control in everything. They have many accessories, for example, like lenses, like flashes, like many things. They are bigger in size and more expensive. Okay, now types of flashes. Let me start with the cheapest type of flashes, pop-up flash or built-in flash. It's the flash come inside the camera, so you don't have to buy this type of flashes. And the second type of flashes, external flashes. Okay, in dental field we are always using ring flash and twin flashes. This is the third type of flashes, ring flash, and this is the fourth type of flashes, twin flashes. And now with the last type of flashes, studio flashes. Okay, with the studio flashes, they are available in a variety of shapes and sizes. The soft boxes are used for softening the light, and believe me, always the professional results comes from the studio flashes. They help in giving very high image quality, and they are bigger in size and more expensive than the external flashes. Okay, so what's the purpose of using artificial flashes? Of course, the purpose is highlights the entire oral cavity. So we need to highlight this area. Why? Because we are working in this area. So now we have rule of yes and no and maybe. Let me now start with yes. Yes level means like this. If anyone asks you something and your answer is yes, you will move your head like this. With yes rule, you should exactly take the photo with zero level, not up and not down. Why? Because when you are taking photo with upside, the patient's teeth will look now short. Okay, when we are taking photo from downside, the patient's teeth will look very long. So with the first rule for the 3D smile design, with yes, we should take the photo in the zero level, exactly. Second rule, no level. Of course, if anyone asks you something and your answer is no, you will move your head like this, and we need to take picture exactly in the zero level, not to the right side and not to the left side, exactly in the zero level. Why? Because if the patient moves his head to the right side, the left side of his teeth will become bigger than the right side. Why? Because they are now visible. So we need to take our picture with exactly with the zero level, also with no level. Okay, now about maybe side. This is the maybe side. Exactly, of course, we need to take photo with exactly with the zero level, not to the right and not to the left. And we can only with maybe level, we can adjust it by using the GPS software, and we can arrange it and fix this level. But with yes and no, we cannot. Okay, let me show you something else. Now we can take picture with this standard setting. We need our camera should be exactly at the same level with the mouth, exactly, and we should keep little space between the dentist and between the patient. So the distance can be 1 meter or 1 meter and a half, much better. Try always to take a plain background. Try to avoid the black background. Take blue or white or silver, will be much better. Okay, now camera modes. Okay, if you are a Canon user or if you are a Nikon user, it's very easy and very simple. We will not work with manual control. We only need an auto mode. With Canon, we can use Creative Auto, CA, and with Nikon, we can use auto mode. We only need to take a simple photo by using your flash, by using your built-in flash or your ring flash or your external flash, whatever. The only flash you have is the only flash you will use by using auto mode and your camera. That's it. Okay, let me show you now common mistakes. This is the first one. The problem here with what? The problem here with maybe level. Okay, we should always take our picture with zero level in yes and no and maybe. Okay, check this now. This we have the problem with maybe level, and we have here yes level. Okay, let me show you the correct photo. Exactly, we have the zero level with yes and no and maybe. This is our ideal picture. By using also the plain background, white background, not white background, not black background. Thank you very much. And this is the basics of 3D Smile Design photography. So now let me tell you something about our course. I will tell you some topics in dental photography course. So I will talk about many things, starting from types of cameras, types of lenses, types of artificial flashes. And after when we finish these types of cameras and lenses and flashes, now it's the time to take the driving license, how to drive your equipment by learning basics of dental photography. Basics of dental photography, we have 5 main basics of dental photography, starting with aperture and shutter speed, ISO, depth of field, and focus mode. After when we learn all of these basics, now it's the time to drive, or you drive or me drive, our equipment, our cameras and our macro lenses and our artificial flashes. Okay, now we have the driving license. Where should we go? We have 4 main ways, starting from intraoral photography to close-up photography and extraoral photography and determining the color of the teeth. This is our 4 ways. If we have our equipment, we should go to one of these ways. Okay, and we will learn about artistic dental photography. Artistic dental photography for what? For social media and for marketing and for branding your name. And I will talk about dental lab photography, everything about dental lab photography, all the settings about your dental lab photography, accessories, and some of my professional techniques. How can I take my professional pictures in my lab? I will tell you some of my recommended editing softwares, and for the first time, tips and tricks for getting a great videography shots. I will teach you exactly how to put your setting, how to calibrate your camera to use it for videography shots, and how to export your video with very good and easy way for if you are using your video for social media, for YouTube or also for social media. This is our topics for our next course. Okay, now in the first day will be with me. I am Muhannad Abdul Jawad. I will talk about everything about dental photography. And the second day will be with Dr. Ahnaf Al-Jaja. He will talk about GPS 3D smile design. He will teach us everything about GPS smile design and how we can making a digital smile design in 3 minutes. And the last day will be with Dr. Gomez. He will talk everything, he will teach us everything about veneers, starting from taking the impression till we fix our veneers. So I'm very happy to be here, and I'm very excited to see you on the 3rd of February in Dubai. And I'm looking forward to see you there. Believe me, we will have fun. Thank you very much.
Now let me tell you how can you become a certified smile designer, and then how to become a professional certified trainer. To become a certified smile designer, you need to enroll into a Mastership course in Aesthetic Dentistry, which is conducted in Dubai on February 3rd to 5th, 3 days. In these 3 days, you will take 6 workshops. Who will teach you in that course, Mastership course? First, me and Mr. Muhannad and Dr. Herman Gomez from Germany. And to become a professional certified trainer on 3D smile design by GPS, first, there is four steps. Then you will become a certified trainer. First, enroll into a Mastership course in Aesthetic Dentistry in Dubai. Second, practice the smile design on 3 cases. And third, train the trainer course. Enroll into train the trainer course, TOT online course. And by this, you become a certified trainer. In the first day of the Mastership course in February, you will get advanced dental photography techniques and for the first time, videography. Number 2, which is 4th of February, I will teach you advanced 3D smile design and you will make 3 cases by yourself. In the last day, 5th of February, 3 workshops about veneers, all about veneers: preparation, impression, temporization, cementation, and for all kinds of veneers. Thin veneers, non-prep veneers, composite veneers, traditional veneers, Emax, everything. And because you are here today in this webinar, you get your special offer when you enroll in the Mastership course in Aesthetic Dentistry. And when you go to EDIC, you will get 2 free nights in Dubai and 1 month of the GPS software on your computer, so you can practice your first cases free of charge. Now let me share with you this video.
Meet me on the 3rd of February in Dubai. In this great course, we will learn everything about professional and artistic dental photography. And for the first time, amazing tips and tricks for getting great videography shots.
In the second day in this course in Dubai, you will learn how to plan for your veneer cases, and you will learn what language you will use when you sell the case to your patient, so you increase the acceptance. And I will teach you how to do a 3D smile design in 3 minutes.
On the 3rd day, I will guide you step by step through everything you have to do for the veneers themselves. That means the preparation process, the impressions, the provisionals, the cementation, and everything else.
We are waiting for you in Mastership course
in Aesthetic Dentistry
in Dubai, 3rd, 4th, and 5th of February 2018.
So how to book your seat? You can call or write on WhatsApp to this telephone number. And I hope that you enjoyed this webinar. See you in Dubai.